Hi, this is President Wilson. I'm back for video. I decided to do one this week because I'm alarmed at the COVID-19 trends in Michigan and in Detroit, and the trends on our campus are also not great. You know, the 7-day rolling average for the state last week was a little over 3,200 cases. In just a week later, for this week, it was almost 5,200 cases. That's an increase of about 2,000, almost 2,000 in just a week. And just yesterday, we hit 6,311. So that really is extremely high. And even on our campus, you know, we have 48 cases last week, which is really high for us. So I really am very concerned. The number of cases per million population in Michigan is the highest in the country. And then the variant, the B117 variant, is the highest proportion of cases. It's number one in the country also in terms of the proportion of cases that's made up of that variant. So these are not good statistics. The other issue which is very concerning is that both in terms of getting the disease and my hospital colleagues tell me in terms of hospitalizations also, a number of younger people are getting it and being hospitalized. In fact, the age group that's under 60, from 10 to 59, is the largest growing age group, much larger than the above 60 age group. In terms of vaccination, Michigan's performance has been, I don't know, middle of the road. Not bad, but not great either. It certainly did improve after Michigan opened up its criteria for allocation and distribution to those that was over 50 years of age. In the most recent decision to open it up to those over 16, I think is the right decision. Now, there's a little bit of debate on that. Some people think that we should still be concentrating on the most vulnerable. But the truth of the matter is that by opening it up, you will get more vulnerable populations also. That's certainly what happened when it's opened up to over 50 years old. And that will happen again, particularly as the vaccine supply begins to outstrip the demand, which is beginning to happen now and certainly will be the case in a week or two. Everyone will benefit. So I do urge everyone to get the vaccine when it's available to them. Wayne State is fortunate in having a campus health center that gets distribution, an allocation of these vaccines. And so starting today, in fact, there will be an email today that everyone in campus housing would be asked to make an appointment to get the vaccine, as well as all athletes will be asked to make an appointment to get the vaccine. And then soon, in another week or so after we get all those students and athletes taken care of, we're going to open it up to all students, all faculty, and all staff. And so we encourage you to make an appointment and get vaccinated. And it doesn't have to be at the campus health center, although that's convenient for you. Certainly there are other venues that are offering the vaccine, and anywhere you can get it, we encourage you to get it. I haven't done a book review in a while. I've been reading a lot of memoirs, actually, mainly because I'm writing a memoir. I think I mentioned to you before, and I thought that reading others might be helpful. Well, I've completed my book now. I've got a couple of people reading it to give me some feedback, and then I go through the process of picking a publisher and getting it published. So starting next video, I'll start back up with my book reviews. I've been a little distracted completing this book now. I'll keep you updated, okay? Thank you.